Good morning, everyone. This is Nicole Ali. This article comes from statnews.com. I'll leave the link in the description box. Published June 25th, 2018. FDA approves country's first medicine made from marijuana. Yes, you heard it here. FDA, so this is the U.S. The name of it is, excuse me for if I misspell it, cannabidiol, cannabidiol, 100 mg per mil oral solution. So it's in a bottle that looks like cough medicine. It is limited by the United States, as you can see on the bottle. It is derived from cannabis sativa L extract containing 100 mg per mil of the cannabidiol. So it is of the oil of cannabis. The FDA on Monday, this past Monday, today is Wednesday, approved the country's first drug derived from marijuana, a medication that treats two rare and devastating forms of epilepsy. So it's starting now with epilepsy. It will probably move into other diseases such as, narcolepsy, autism, perhaps even brain disorders, other brain disorders. And I have a feeling that they will possibly use this to treat these meth heads and opioid heads as well in the future. It always starts where they set precedents on less obvious diseases or conditions such as epilepsy. And then it moves into other areas of disease. They say the drug by GW Pharmaceuticals, it's called, as I said earlier, Epidiolex, is made of cannabidiol or CBD, a component of marijuana that does not give users a high. It is given as an oil, and in clinical trials, it was shown to reduce the number of seizures by about 40% in patients with Dravet or Lennox-Gastaut syndromes. A few years ago, I'll say this, Sanjay Gupta of CNN did a documentary on the benefits of cannabidiol, cannabis, or the oil that comes from the plant, cannabis sativa. Usually it's sativa. And I think that's one of the most popular species of cannabis out there right now that's being commercialized. And they showed the effects on, I think, a child that had epilepsy, another child who may have had autism, and they had positive results, but this was only a very small documentary. It was a case study. I'll try to find a link to that documentary or a clip from that and put it in the description box as well. But I also wanted to go here to the clinical trial itself. And this came out last year, 2017, May 24th. And it says, in a first, scientists show a marijuana component reduces seizures for some with epilepsy. And this is the plant that they're procuring. They're taking from, it looks like a seated container that has multiple compartments here, as you can see. And we'll come down. So they had a full peer-reviewed study from the New England Journal of Medicine. There's a quote here. It says, "We now have solid, rigorous scientific evidence that in this specific syndrome, cannabidiol is effective at reducing seizures," said Dr. Orrin Devinsky, a neurologist at NYU Langone Medical Center. And he's also an author of the new study. But he added, this is not a panacea, meaning that this is not a cure-all. So this was last year. They enrolled 120 children from 2 to 18 years old with Dravet syndrome, which is a rare genetic form of epilepsy that kills up to 20%. So that's 1 in 5 of patients by the time they are 20. At that time, there was no known cure for this, but they wanted to stop the convulsive seizures that were occurring in these children. They found over 14 weeks of treatment, the cannabidiol group decreased from 12.4 to 5.9 seizures per month. For the placebo group, the number went from 14.9, or that was for the treatment group, 12.4 to 5.9 per month. And the placebo group went from 14.9 to 14.1, which is not significantly relevant. So the cannabidiol group was significantly relevant, almost cut the seizures in half during that 14-week period. In the cannabidiol group, 43% of patients had their number of seizures cut in half or more, compared with 27% in the placebo group. And 5% of patients that were taking cannabidiol saw their seizures disappear, compared with none in the placebo group. Now let's come down to the side effects. The most common side effects are vomiting, fatigue, fever, drowsiness, and diarrhea. 8 patients in the group withdrew from the trial because of the severity of the side effects. So this is why it's important to know what exactly happened, and that's why, excuse me, my stomach is growling. That's why I came to you earlier with information on how to search for these peer-reviewed articles and clinical trials. I hope that this was informative for you. I'll leave links for these 2 articles in the description box, of course. And this may not be as positive as they're putting it out to be. As I said earlier, it may be the precedent for them using these types of drugs for people who are suffering, or, drug addicts who are on meth, opioids, and other codeines, hydrocodone, and the like, and we already know who they are. The people who have albinism, the Caucasoids. So we'll see where this story goes. I hope that you enjoyed this article. Please leave your comments, questions, suggestions in the comment section below. I'm very hungry, so I'm gonna go get me some breakfast. I'll see you all in the next video. Have a great day.